In this video, we will be discussing the various levels of upper limb amputation. There are an estimated 2.1 million people in the United States currently living with an amputation, and approximately 18,500 new upper limb amputations occur every year. Due to the prevalence of limb loss, it's necessary for occupational therapists to have a basic understanding of what is occurring at each level. We will start by talking about the more proximal levels of amputation at the shoulder level. Then we will move more distally to above elbow amputations, below elbow amputations, and finger and partial hand amputations. Some amputations are referred to as disarticulations. A disarticulation is the surgical separation through the joint, as opposed to cutting through bone. Some examples of this include a shoulder disarticulation, elbow disarticulation, and wrist disarticulation. Shoulder level amputations are the most proximal level of amputation of the upper limb and can be either a forequarter amputation or a shoulder disarticulation. A forequarter or interscapular thoracic amputation involves the removal of the entire upper limb by cutting through the scapula, humerus, and portion of the clavicle. A forequarter or interscapular thoracic amputation is the highest level of upper extremity amputation and occurs at the arm, scapula, and clavicle. This level involves the removal of the entire upper limb and shoulder joint. An amputation of this caliber usually follows severe trauma, tumors, or infection permeating the muscles of the shoulder. This level results in the total loss of scapula, arm, and hand function. Next, we have a shoulder disarticulation. A shoulder disarticulation involves the separation of the humerus from the scapula and the clavicle. A shoulder disarticulation involves the complete removal of the humerus from the glenoid. Shoulder disarticulations are rare and pose greater challenges in accommodating a prosthesis than more distal upper limb amputations. However, this procedure preserves the natural shape of the shoulder, making it more ideal for clothing wear. Let's move more distal on the upper limb and discuss above elbow levels of upper limb amputations. The two above elbow levels include a transhumeral level amputation and an elbow disarticulation. A transhumeral amputation involves the removal of part of the upper limb by cutting through the humerus bone. This level of amputation can occur anywhere above the elbow and below the shoulder joint. An individual with an amputation at the transhumeral level experiences loss of the majority of their upper extremity, as well as decreased shoulder internal and external rotation. An elbow disarticulation occurs when the radius and ulna are separated from the humerus at the elbow joint. Because this is a disarticulation, no bones are cut. With an elbow disarticulation, the broad flare of the remaining humeral condyles can enhance prosthetic fitting. This type of amputation also preserves rotation of the humerus. Now let's discuss the below elbow levels of upper limb amputations. This includes a transradial amputation and a wrist disarticulation. A transradial amputation is the removal of part of the upper limb by cutting through the radius and ulna bones. This is the most common level of upper limb amputation. In addition to a transradial level amputation being the most common level of upper limb amputation that occurs proximal to the fingers, it's also the most likely level to use a prosthesis. A transradial amputation results in decreased forearm motion and loss of wrist and hand function. The preservation of any forearm length is ideal to allow some degree of pronation and supination. A wrist disarticulation involves the separation of the radius and the ulna from the hand. Because it's a disarticulation, no bones are cut. A wrist disarticulation occurs at the distal radio-ulnar joint. Due to the full forearm length being preserved, pronation and supination remain possible, but wrist flexion and extension are lost. Let's move on and discuss finger and partial hand level amputations. A partial hand amputation can also be described as a transcarpal or transmetacarpal level amputation. This involves the removal of part of the hand by cutting through either one or more carpal or metacarpal bones. Amputations distal to the wrist account for the majority of all traumatic amputations of the upper limb. Like it was mentioned in the previous slide, a partial hand amputation can occur either as a transcarpal amputation or a transmetacarpal amputation. In this instance, supination and pronation of the forearm and flexion and extension of the wrist are preserved. However, functional use of the hands are greatly impacted. The most distal upper extremity amputation occurs through a finger, also known as a transphalangeal amputation or a digit amputation. This involves the removal of part of the hand by cutting through the phalanges. This level of amputation can greatly impact fine motor skills, including grip and pinch strength, dexterity, and coordination. However, the more proximal levels of amputation are more challenging to rehabilitate as they possess fewer joints and muscles and require more energy to use a prosthetic device. Which level is the most common level of upper limb amputation? Is it a shoulder disarticulation, a transradial amputation, a transhumeral amputation, or a wrist disarticulation? The correct answer is transradial. A transradial amputation is the most common level of upper limb amputation. Which level involves the separation of the joint as opposed to cutting through bone? Is it a forequarter amputation, a transradial amputation, a transhumeral amputation, or an elbow disarticulation? The keyword here is disarticulation. A disarticulation involves separating the joint as opposed to cutting through bone. A forequarter, transradial, and transhumeral amputation all involve cutting through bone.